COVID-19 has forced many businesses to completely rethink how they can operate without spreading the virus. Plastic surgery clinics and departments are no different. Safety has always been our priority in plastic surgery, but it has been taken to an even more complicated and important role during this pandemic, especially for surgeons who operate on the nose. As you know, COVID-19 spreads via droplet infection. The highest viral load is found in the upper respiratory tract and nasal cavity. This means that rhinosurgeons are at a particular high risk for infection among medical workers. To determine the safest way possible to perform rhinoplasty during the coronavirus pandemic, the Rhinoplasty Society of Europe convened a digital summit of some of the world's leading experts on nasal surgery to discuss, debate, and come up with some concrete advice. Recommendations to assure protection during patient consultations included masks with 80% minimum filtration for all parties, increasing airflow, turnover in the room, and the standard disinfection of high-touch surface areas after each patient examination. Preoperative recommendations included COVID testing via nasal swab 2 days before surgery and the patient self-quarantining for 5 to 7 days before the operative procedure. The group also agreed that functional rhinoplasty should be performed given these additional protections and adequate PPE in the operating room. For elective rhinoplasty, the authors could not offer global guidance, but they did state that every surgeon needs to follow their specific local health and regional authorities and rules for optional surgeries and then weigh the risks versus benefits in their region. Intraoperative recommendations included disinfection of the nasal cavity, facial shields and masks with 94% or higher filtration rate, modifying the use or not using power instruments, or adjusting the airflow in the operating room, all aiming to completely increase the volume of air exchange a lot more per minute. Given that we're shooting this video in late January 2021, we're still learning so much more about COVID-19 every day. These recommendations will require frequent reevaluation and update. That said, their guidance is still strong and a great starting point to keep surgeons, staff, and our patients very safe during rhinoplasty surgery during the COVID-19 pandemic. If you want to learn more about the intersection of coronavirus and plastic surgery, please follow our amazing special selection and collection of peer-reviewed COVID-19 articles only on prsjournal.com.